Hey, well, family, so a lot of you have been hearing so much about the laser. Maybe a lot of you have even experienced its great results for your injuries or sprains or strains or your disc regeneration. Listen, it's time for me to experience it too. I was stepping off a stepladder, I twisted my knee up, and thankfully I knew exactly where to come and what to do to get help.
So today what I want to do is walk you through the science of the laser therapy treatment.
One of the reasons I immediately thought of getting the laser treatment when I hurt my knee is because I didn't want to have to take a bunch of pain medicine. I didn't want to have to go and get a lot of shots, and I really couldn't take off work for the amount of time needed to just sit and rest and ice my knee. I have stuff that I have to do.
So when Danny came in that one morning, she was obviously limping and in pain, so we brought her back here and we brought her to the exam table and we did a series of orthopedic tests on her knee. What we discovered is she has really painful tenderness on the inside medial aspect of the knee where the meniscus is. That's the cushion between those two bones of her knee. She also had a lot of tenderness on the MCL, or the medial collateral ligament. So in layman terms, we determined that Dania had two main ligaments in her knee that were sprained from her injury. The tendons and the ligaments, they don't have a good blood supply. So the laser has actually two lasers going in at this one time simultaneously. You got one that's going to go in and kill a lot of the pain and inflammation, get the edema and the swelling out of there. The other one is going to go in and bring the vasodilation, the blood flow in there to stimulate the chondrocytes and actually heal that tissue a lot quicker.
When our knee is off, it's going to mess up our hip. It's important to, as patients come in for an examination, x-rays, we measure the hips, and so using the wedges is going to be very important for someone that has a knee problem, a hip problem, or even up into the lower back. Most of the time when we injure one area of our body, we're going to compensate and put all of our weight to the other side. And so it's important to get the body squared away so that we can balance that out. And many times we almost have to overcompensate to get that muscle working. But we need to get rid of the pain, get the function back, get the unpinching in the hips, so that we can sit square, stand straight, and put weight equally on both sides in order to allow that to happen. Otherwise, we're going to continue to have antalgic posture and lean away from the pain and avoid the hurt. Our body doesn't want to go into that position that hurts. That's just natural. When someone has an injury to a part of their body, it is very important to have repetitive treatment with adjustments. We do average of 3 times a week. With laser, it's the same thing. Recommended treatment is 3 times a week, minimum of twice a week, so that the treatment can progress, so that the results will be there. With laser, we want to have a minimum of 2 times a week, and you can do it every day. If somebody has a very serious injury and we want to get them back to functional as soon as possible, daily treatments are what we do with the laser.
So like most people, I Googled my symptoms as soon as I started getting them, and Google told me that for even a mild sprain on my knee, it was going to take 4 to 6 weeks for me to start feeling better. I didn't really like that. I was a little nervous about it. However, it's been, at the time of this recording, 2 weeks since I injured my knee, and I am feeling so much better.
The knee is just one of the many things that the laser can help with. I've helped many people with sprains, strains of the shoulder, tendonitis, plantar fasciitis, people that needed knee replacement because they were told they were bone on bone. This laser can go in there and stop a lot of that pain and inflammation and stop them from having unnecessary surgeries.